Right. Well, it's a really young picture of me. Need to send an update one. All right. Well, thank you so much for the opportunity to be a part of this afternoon discussion on long COVID. And I'm really excited to be here to be able to give this presentation. Specifically, I would like us to kind of pivot and focus over to the public health priorities and challenges related to post-COVID-19 conditions, as well as COVID-19 in general, which of course are intricately connected. One of the things I wanted to point out early on was kind of how our mindset and approach towards COVID-19 has evolved over the pandemic. And I really tried to dig into our internal archives and think back on some of the newspaper headlines that really made us aware of the health impacts of COVID-19. And I think back at this media headline that I saw published in NPR, where Tony Fauci was estimating that about 100 to 200,000 people in the US would die from coronavirus. At the time, I was thinking to myself, wow, that is astounding. That is horrific. I hope we never get to that point. But fast forward to 4 years later, we see a mindset change that even though the CDC is now reporting that at least 6.7 million hospitalizations as of January have been reported to them due to COVID-19, as millions, almost 1.2 million deaths due to COVID-19 have been reported, people have really been feeling that inertia to move towards and put COVID-19 behind them. And that's a real challenge for us here in public health about how to continue to put COVID at the forefront of everyone's mind to ensure that people are taking the precautions, especially as they're especially as they're reverting back to pre-pandemic behaviors and activities. And one of the focus areas for us in public health has been trying to integrate the post-COVID-19 condition or long COVID component into our messaging, highlighting for people who otherwise may not see themselves as vulnerable, frail, or in older age groups, which would be risk factors for acute illness severity, but would be still at risk for post-COVID-19 conditions. And so oftentimes people then ask me, as I'm integrating this into messaging, well, what exactly is the burden? What exactly is that magnitude? And as Dr. Kwan-Gett mentioned, this has been really difficult to measure, and a lot of different models have been proposed to be able to get to that. And here I use a very quick and dirty back of a napkin kind of model, just estimating based off the number of COVID-19 cases reported to WHO, which we know is an underreport of the total number of cases globally, and use a conservative measure of just 10% of people who go on to develop a post-COVID-19 condition. And even with that, we arrive at a very startling number, 77 million people who have had post-COVID-19 conditions or continue to experience them now. And again, we know that this is likely an underestimate of the true burden internationally. And when you pair this up with people's experiences, the actual health burden that people go through when they have a post-COVID-19 condition, this situation is magnified. This is not simply a minor inconvenience that people are experiencing, a minor symptom, but signs, symptoms, and conditions that are incredibly debilitating that completely change a person's perspective and ability to kind of even get through life. And even from an economic perspective, we see this impacting people's ability to get back to work, to be able to do the same level of work that they did before. And some estimates comparing some of the costs associated with clinical phenotypes of post-COVID-19 conditions to ones that are similar to chronic fatigue syndrome. We know that there's going to be significant healthcare costs. And some organizations have even estimated that here in the US, that as of January 2022, there's been a substantial economic burden placed on our country as a result of this, hence why this remains a public health priority. And admittedly, we're still early in our discussions as we're continuing to uncover and contribute resources to researching this. But one of the biggest hurdles that we face right now is really the fact that this is a diagnosis known by many names. For some of you in the audience, you may be more familiar with the term long COVID. For others, you may be using post-COVID-19 conditions, a term that WHO, CDC, and Infectious Diseases Society of America have moved towards. And also the NIH Recover study has also historically used use the past definition. And with each of these names comes different definitions too. And so as you can imagine, when people are trying to understand results and compare results between studies, it's been a real challenge. But fortunately, the National Academies of Science and Engineering and Medicine have started to convene work groups to try to unify a diagnosis and to draw upon people's lived experiences of having long COVID and be able to integrate this into a living, evolving definition. So more to come on this point, but a lot of efforts have been to try to bring us all together to be able to compare apples to apples. But in terms of truly understanding, based on the available data, what the true burden of COVID-19 is, I thought that Dr. Eric Topol's team did a really good literature review published in Nature's Review Microbiology to try to summarize all the available data that's out there on post-COVID-19 conditions and be able to provide these ranges of prevalence of different post-COVID-19 conditions by different patient groups. And they found that in their literature search that between 10 to 30% of non-hospitalized cases go on to develop a post-COVID-19 condition, 50 to 70% of hospitalized cases, and 10 to 12% of vaccinated cases go on to develop post-COVID-19 conditions. And Dr. Kwan-Gett also alluded to this, but one of the other important points that I really want to try to emphasize, and I emphasize every time I talk about post-COVID-19 conditions, is that we know that the pandemic has exacerbated racial and ethnic disparities when it comes to infections and just health outcomes. And even though we haven't fully elucidated that yet for post-COVID-19 conditions, we know that from our experiences at the height of the pandemic, that when compared to white populations, Black and Hispanic populations have increased rates of SARS-CoV-2 infections and increased risk of hospitalizations due to COVID-19. And the combined elements we know also should put people at increased risk for post-COVID-19 conditions. And this is an important area of research that we need to commit resources to. Even just some early data has already shown the importance of ensuring that at least in our study participants represent a diverse group of individuals, that if we are to only include white populations in our research studies, that we may be missing the full spectrum of clinical presentations associated with post-COVID-19 conditions. And just early publications from people's experiences in terms of ensuring that there's access to post-COVID-19 condition clinic resources, we're seeing disparities as described in this report by this one clinic's experiences. But fortunately, over the last couple of years, we've made substantial progress in terms of papers that have put together really nice public health messaging that has highlighted the importance of ongoing integration of lessons learned that we should be taking away from the height of the pandemic. That is, of course, staying up to date with recommended vaccinations, integrating that along with layered approaches, wearing a mask in indoor crowded spaces. I'm so excited to see that so many people in this room are wearing high quality, well-fitting masks. And improving indoor ventilation, getting tested early and getting treated early, all elements that are really important to reduce risk of infection, risk of severe disease, and subsequent risk of post-COVID-19 conditions. And in these two studies here, it also emphasizes the reasons why, even though you've had COVID-19 before and you somehow managed to dodge post-COVID-19 conditions, the reasons why these layered approaches are still relevant to people's, are still beneficial to people for subsequent infections. And a lot of work has been going into understanding what ways people or what strategies people can take to help reduce the risk of post-COVID-19 conditions. A lot of focus has been on vaccinations. And I'm really excited to see all these publications published over within the last 2 years that have really highlighted that staying up to date with the recommended COVID-19 vaccinations does help people reduce the risk of subsequent development of post-COVID-19 conditions. But it's also an important thing to point out here that COVID-19 vaccinations alone is not going to completely reduce your risk of post-COVID-19 conditions, that we do need to take a layered approach, that in addition, again, to vaccinations, we should be focusing on masking indoor public spaces and improving indoor ventilation. A lot of interest has been put into, of course, also looking at treatment and the treatment's impact during acute COVID-19 and the subsequent development of post-COVID-19 conditions. And I'll say that this is an early area of research. Some observational studies have shown mixed results so far, but I think it's safe to say that any effort that you go into to try to reduce your risk of infection and reduce severity of disease at the acute stage is also likely to have some benefit at the post-COVID-19 condition stage. Now, as I summarize kind of my last few thoughts here, I want to leave you with an important message that I thought was really well articulated in this perspective article published in the New England Journal under the title, "Do Pandemics Ever End?" And they emphasize a really important point that I think is a key piece that we're really trying to emphasize in public health as people throw caution into the wind and try to normalize some of the health burden that we continue to see. And the only people that are going to be, or the people that are going to continue to be disproportionately impacted, again, are those people who have experienced historic inequities, especially during the height of the pandemic. And I want to read this because I think this point is really important, because people oftentimes ask me, well, when is the end of the pandemic? And I think that this summary here is really an important thing for us to all kind of think about when we're talking about this with other people about why COVID should still be at the forefront of our minds. And that is, the declaration of the end of a pandemic therefore marks a critical point when the value of a human life becomes a variable of actuarial significance. In other words, when a government determines that the social, economic, and political costs of saving a life exceed the benefits of doing so, it is neither epidemiology nor any political declaration that determines the end of a pandemic, but the normalization of mortality and morbidity by means of a disease's routinization and endemicization, what in the context of COVID-19 pandemic has been called living with the virus. And this is a message that really resonated with me and really helped me put into context kind of all the work that we're doing within public health, all the work that everyone's doing here within with regards to the clinical support and continuing to message the importance of prevention for acute COVID-19 that should subsequently also decrease our risk of post-COVID-19 conditions. So when people ask me what keeps me up at night, it's just that, is that people are going to throw caution to the wind, that people are going to let go of those pandemic lessons learned, this feel this draw to put COVID-19 behind them along with all those other lessons learned, when in reality, we should be really taking the situation seriously, knowing that with increased risk of acute COVID-19 severity, we're likely to also see increased rates of post-COVID-19 conditions. And that we already see some early evidence that what our strategies to reduce risk of infection and severe disease are likely also to help reduce the risk of post-COVID-19 conditions. And I consider myself very fortunate because I happen to be able to practice public health in a location where I think we actually do a much better job than most other places at putting COVID-19 at the forefront of people's minds. Emphasizing again, trying not to trivialize or normalize the death and the health burden associated with COVID-19. And again, I always say this because it sounds like I'm a broken record, but some of the same principles that have been so helpful to us to reduce our risk of subsequent complications associated with COVID-19 are still true today. And that is, of course, staying up to date with the recommended COVID-19 vaccinations and taking a layered approach, wearing high quality, well-fitting masks, indoor public spaces, improving indoor ventilation, getting tested early, and getting treatment when you're eligible. So I'll conclude there, and I'll take any questions towards the end. Thank you.